Hi, my name is Gayatri Mahajan. I'm actually a developmental pediatrician who's the clinic director of the Mind Transition to Adulthood Clinic. I'll give you a little bit of background about me and the clinic. I actually came from the world of primary care. So I was a primary care pediatrician for over 12 years. And I'm sure everyone in this room knows how busy primary care is. You get 15 or 20 minutes per patient, and we all know how many more minutes our patients with neurodevelopmental disorders need. So I started this clinic about 3 years ago. Several intentions. One was to take some of the burden off primary care because they just don't have the time to do comprehensive transition of, not just healthcare, but really transition in all aspects of transition. Another big reason was to provide training for internal medicine and family practice. So I actually have family practice and internal medicine residents rotating through my clinic. And many of them don't even know what is autism, what is intellectual disability, how do you support someone in a primary care adult clinic when you have sensory needs or you need extra time, how do you talk to a patient and not just the parents, those kinds of things. So this, and the other reason was really to create a social model, not a medical model. So we talk about all aspects of transition. We talk about healthcare transition and self-management skills, but we also talk about, reproductive health, safety, exercise. We talk a little bit about employment and education, and Steve Ruder, who's coming after me, he spends a lot of time in our clinic talking to families about those things. But I also talk about online safety. I talk about mental health. So it's a very comprehensive approach to transition, and we just don't focus just on healthcare. One of the things that I realized when I started this clinic, I thought everybody would be really interested in healthcare transition, but almost every single patient, and I ask every patient, what are your goals? They all want a job. So, point made by Marjorie is very real because that's what everybody wants. They want a job. We see youth between 16 and 26 with primary neurodevelopmental conditions. So we don't see people with primary mental health conditions just because of capacity issues. But we do see people with comorbid mental health conditions, which almost all our autistic youth have. So, and we try to connect families with adult healthcare providers by providing a portable transition summary. I also give them guidance on how they can manage their own healthcare in the adult world. And we talk a lot about who makes decisions when you're an adult. What is the paperwork that you need? What is supported decision making? What are the alternatives to conservatorship or guardianship, as it's called in other states? But we try to explain the different systems of care, which is my real interest, is what does the regional center do? What does the school system do? What does the healthcare system do? And why none of them ever talk to each other, and how you have to be the gatekeeper of all those services. So as I mentioned, that's our clinic team, and we do have a social worker who's available part-time, and it's on a case-by-case basis. But Steve Ruder, who is also on the panel, is a big part of my clinic, and I'm very grateful for his experience, with the transition and adult age. So what I do is I usually have a clinic visit, and I realized over time that spending 1 hour asking the parents all these questions is really boring for our patients. So I started doing intake visits by telehealth, where I get all the background information from the parents, and sometimes the youth participate, sometimes they just want to wander away, but that's okay, because I'm going to see them in person the week after. And during that in-person visit, I really try to spend one-on-one time with them, and I give them the option of whether they want their parents there, but many of them are actually okay, and they're pretty honest with me, and they tell me many things that they probably wouldn't share with their parents. We actually give every patient an action plan. It's it's like in a table, and we put down, this is high priority. For example, you're graduating in 3 months from high school, and you have no plan, so that would be a high priority. What are you going to do next? And other things can wait. We try not to overwhelm them with too many tasks and just say, okay, these are the top 3 things that you have to focus on. And we do follow-up by telehealth, which makes it, it's an after-school telehealth appointment. So it makes it really easy for families and youth to engage. And we also give every patient a healthcare passport. Some of our, cognitively able patients use healthcare portals from the healthcare system, but many of them need a much simpler healthcare passport, and we ask them to take a picture and keep it on their phone or carry a paper copy, whatever their preference is. This is a medical appointment, so all our referrals come from other providers. We get a lot of referrals from primary care, both in pediatrics, family practice. We get lots of referrals from developmental pediatricians in the Mind Institute. We get many, many referrals from genetics. So we see, a whole range. We see, college age youth who are actually in college. We also see severe intellectual disability who are total care. So it's a whole range of neurodevelopmental disorders, and there's no one formula that fits everyone. So it's very individualized kind of recommendations.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.